Hey everyone, today I will speak about diabetic gastroparesis. Firstly, look at this woman. This is simple drawing. Imagine this woman having a long-standing DM, and when I offered to her a food, she gave to me a sad face, a sad expression. So, why this happening? Let's begin with the normal physiology when food coming from the mouth, entering the esophagus, here, to enter the fundus and coming into here. The vagus nerve, which supply the stomach, it will send a signal from the brain to let all these parts that is under its control working. The fundus part will be relaxed to let the food come in without any problem, and the body part, which is that part, will release an enzyme and an acid like HCl to digest the food into small particles. So when this is a small particle, will go into what is called pylorus. Pylorus having two parts, pylorus canal and pylorus intrum. Here is the pylorus intrum, and here is in green the pylorus canal. Pylorus intrum will turn this small particle into what is called chyme, which is a liquidy form and the end digestion inside the stomach. Normally, and also under control of vagus nerve, this here is what's called a sphincter or a pylorus channel. This channel will be open for a brief or short time to let part of this chyme that is here, that is liquidy form, just part of it, enter the first part of a small bowel, which is called duodenum. But in case of patient with DM, what happening to let this woman feel sad? Actually, every time the patient with DM having uncontrolled or high blood level sugar, the small blood vessel inside his or her body will be damaged. This part of this small blood vessel is actually supply that vagus nerve that we talk about, that is actually the major part inside body, or actually the major part for stomach here to work. So when this small vessel that supply the vagus nerve damage, the vagus nerve will not work properly. So stomach, there is no signal that comes from brain to stomach to contract, to digest, and to let part of this digestion come into duodenum. So food will stay inside the stomach. The complication is so obvious, like nausea, heartburn, and also the complication will be more bad, like glycemic instability, because we don't have a predictable time for this food to be digested. So sometimes she even didn't eat anything and she had a high level blood sugar. Sometimes the patient will come suffering from psychological impact because he always have an abdominal discomfort, so he or she can having anxiety, depression, also medication problem. Sometimes he get the drugs at the time, but the drugs, it does not absorb at a proper time, and it all will affect his life or her life. And last complication, actually a lot of complication, but one of these is bizarre formation, which is undigested food mass. We have a lot of diagnostic tool like breath test, blood test, clinical suspicion. But the main part is the treatment that patient want to hear is actually the dietary modification, the lifestyle modification, the exercise, and the main thing he or she eat the food in frequent meals. Like instead of eating a large meal in one time, he divided the food into 4 to 6 times per day. And for some people asking, is there any pharmacological therapy? Yeah, there is, but the only FDA approved one drug is metoclopramide. There is no other drug that's approved yet. Thank you.